This is Mitchell Shiffman. I'm the director of Liver Institute of Virginia, part of the Bon Secours Mercy Health System in Richmond, Virginia. I was one of the co-investigators of the ELMWOOD trial, which is a randomized placebo-controlled trial of elafibranor evaluating placebo versus 80 milligrams and 120 milligrams of elafibranor daily. The initial study was for 12 weeks. The results of that initial 12 weeks of study has been previously reported at a previous meeting. The results that were presented earlier today were an extension of that 12 weeks. At the end of the 12 weeks, the 120 milligram dose of elafibranor was chosen, and all patients after 12 weeks were then placed on the 120 milligram dose, which was the most efficacious dose during the first 12 weeks. So the 80 patients on the 80 milligram dose were moved to 120. The patients on placebo were moved to 120. Overall, at 12 weeks, there was a significant 46% reduction in alkaline phosphatase in patients on that 120 milligram dose. The 80 milligram and the placebo patients had a further reduction in alkaline phosphatase when they were switched to the optimal 120 milligram dose, and that response was maintained in the highest group and continued to improve and approached what was seen in the 120 milligram group by the end of this extension study. In addition, there were further reductions in liver transaminases, AS and ALT, in the lower dose and placebo group, and reduction in liver stiffness as measured by ELF, and improvement in itching as measured by the worst itch score. So once those But the most important thing is that the maximal dose group treated for 120 milligrams in the first 12 weeks did not lose any of those significant improvements in either alkaline phosphatase, liver transaminases, bilirubin, liver fibrosis, or itching. They all continued at that improvement with no evidence of worsening or rebound back to normal. And both the placebo group and the lower dose elafibranor group continued to have further improvements and approached or matched what was seen in the high dose group. So very, very promising results for elafibranor in patients with PSC, a disease which really needs a treatment because there is currently no treatment for this disorder.